Welcome to NCLEX Map, where precision meets practice. Today we're diving into one of the most crucial and often daunting areas of nursing: medication administration and dosage calculation. Every drop, every milligram, and every decimal matters. Remember, medication safety is synonymous with patient safety. Let's kick things off with the 5 rights of medication safety. Right patient, right drug, right dose, right route, and right time. And for excellence, we add right documentation, right reason, and right response. Starting with the right patient, always use 2 identifiers: full name and date of birth. Room numbers or appearances are not reliable. Errors in patient identity are among the top causes of adverse events, so let's be vigilant. Next up, the right drug. Verify every medication label against the MR 3 times before removing it, preparing it, and administering it. Be cautious of sound-alike, look-alike medications. If something feels off, stop and clarify with the provider or pharmacist. Now, let's talk about the right dose. This is where math meets judgment. Check the concentration, safe range, and patient age. Always confirm with a second nurse for high-alert medications like insulin or heparin. One wrong zero can change everything, so let's be precise. Moving on to the right route. Know whether the drug is oral, IV, IM, subcutaneous, or topical. Never assume routes are interchangeable. An IV push instead of an infusion can lead to serious complications. Now, the right time. Follow your institution's policy for schedules and PRN intervals. A late antibiotic or missed insulin dose can drastically affect patient outcomes. Timing is crucial. Let's decode dosage calculation. The formula every nurse must master is desired over. Have times quantity equals amount to give. Always convert units first. Micrograms to milligrams, milligrams to grams, and liters to milliliters before applying the formula. For example, if the order reads morphine 4 milligrams IV and the vial is 10 milligrams per milliliter, that's 4 over 10 times 1, which equals 0.4 milliliters to administer. Always label your syringe clearly and double-check with a peer before giving. IV flow rate calculations are essential for safe and consistent fluid administration. Use volume times. Drop factor divided by time in minutes to find drops per minute. For instance, infusing 1 liter of normal saline in 8 hours using a 15-drop factor equals 31 drops per minute. Document start and end times, and monitor the site for any signs of infiltration or phlebitis. Now let's discuss high-alert medications. These require a second check. This includes insulin, heparin, digoxin, narcotics, and vasoactive drips. A small error can have serious consequences. Always check blood glucose before administering insulin, and never mix long-acting insulin with others. If a patient is NPO, verify orders before giving insulin, as it acts quickly and can drop levels fast if the stomach is empty. For heparin and anticoagulants, monitor APTT for heparin and INR for warfarin. Be vigilant for signs of bruising, bleeding gums, or black stools, and keep antidotes ready. With digoxin, always check the apical pulse for 1 full minute and hold if it's below 60 beats per minute. Monitor for nausea, vision changes, and halo effects, which are signs of toxicity. When dealing with narcotics and controlled drugs, verify the order and dose with another nurse. Document waste immediately and secure all medications according to DEA policy. Observe the respiratory rate. If it's less than 12, hold the dose and notify the provider. For titration drips like dopamine or nitroglycerin, calculate the dose in micrograms per kilogram per minute. Use an infusion pump and document any rate changes clearly, rechecking the order and pump settings before adjustments. Now, let's talk NCLEX strategy. When a question includes decimal points, be alert for placement errors. A dose of 10 mg versus 1.0 mg can be deadly. Use leading zeros and never trailing zeros. If any calculation seems unsafe, hold the medication and clarify before proceeding. NCLEX questions on medication often prioritize safety over math. Look for keywords like verify, clarify, and monitor. Choose the option that prevents harm. That's true clinical judgment. In summary, always check the 5 rights, calculate with precision, and respect every zero. High alert medications demand team verification. The nurse who thinks before pressing administer is the one who keeps patients safe. If this deep dive helped you understand how math and judgment work together, share it with your nursing family. Like, subscribe, and stay connected to NCLEX Map, where every dose you calculate builds your clinical confidence. See you in the next presentation. Thank you for watching.